All right, let's dive into something pretty fascinating. We're talking tremors in cats.
Specifically, tremors linked to hepatic encephalopathy.
Right, and we're looking at a 2024 study from the veterinary record.
It examines tremors in cats with either HE-CPSS.
Hepatic encephalopathy due to congenital portosystemic shunts.
That's right. Or PANS.
Postattenuation neurological syndrome.
You got it.
Now, what really stood out to me in the study, they found tremors can be the only neurological symptom.
In a significant number of cats with HE-CPSS, yeah.
Which is a big deal because recognizing these tremors could be key to early diagnosis and treatment.
Absolutely. Early intervention can really make a difference for these cats.
So let's break down this study a bit.
Okay.
They looked at 122 cats.
All diagnosed with portosystemic shunts.
Out of those 19 cats.
For about 15.6%.
Presented with tremors.
And it's important to note, these tremors presented in different ways.
Oh, interesting. Like how?
Well, some cats, they had what we call generalized tremors, affecting their whole body. While others, the tremors were localized to just their head or even a single limb.
Almost like a neurological fingerprint, right?
Yeah, I like that analogy. Each cat kind of exhibiting these tremors in their own way.
Now, here's where I find it really interesting.
Okay.
The study, they couldn't pinpoint the exact cause of these tremors.
It's the burning question, isn't it? Why are these tremors happening?
Yeah. So what are some of the possibilities they explored?
Well, they looked at conditions like Asterixis, Holmes tremor, and Parkinsonian-like syndrome.
And these are all linked to brain regions affected by HE-CPSS.
Exactly. They're looking at how damage to these specific brain areas caused by, the toxins associated with HE-CPSS could lead to the tremors.
Okay, so they're focusing on the brain damage aspect.
Yeah, and they also mention hypermanganesemia,
which is
high manganese levels, as a potential factor.
And why is that significant?
Well, manganese is a neurotoxin, and it can build up in the brain in cases of HE-CPSS.
So even though there isn't a definitive answer on the cause, this study does a good job of kind of exploring the potential culprits.
It really highlights how complex this issue is.
Now, let's move on to what they found in terms of treatment and outcomes.
Okay.
Most of the cats in the study, they received a combination of things.
Yeah, a mix of medical management and surgery.
And what did that involve?
So the medical approach included lactulose to help reduce ammonia levels. And then a specialized diet for liver disease.
Makes sense. And what about surgically? What was the focus there?
Well, surgically, they focused on correcting the portosystemic shunt.
Which is?
The abnormal connection that allows those toxins to bypass the liver. So by correcting that, they're restoring the liver's filtering ability.
I see. And with these treatments, did they see any improvement in the tremors?
Yes. Quite a few cats saw their tremors improve, even disappear.
Really?
Particularly those who had the shunt surgery.
That's good to hear.
It is. But I will say, not every case had such a positive outcome.
I see.
Which again emphasizes how crucial early diagnosis and intervention are.
So it's not a guaranteed fix, even with treatment?
Unfortunately, no. It really depends on the individual cat and the severity of the condition.
One of the things that really intrigued me was that they did an MRI on one of the cats.
Yes, that was fascinating.
And they found lesions in certain areas of the brain.
Yeah, the MRI findings, they really provide a visual representation of the impact of HE-CPSS on the brain.
And these lesions were?
They were found bilaterally and symmetrically.
Oh, wow.
Just a widespread effect.
So walk us through what those images actually showed.
Sure. So they observed hyperintense lesions on T2-weighted images. And hypointense lesions on T1-weighted images in a variety of brain regions.
Like?
The thalamus, the lateral geniculate nuclei, the red nuclei, the caudal collicular, the vestibular nuclei, the olivary nuclei, and the dentate nuclei.
That's a lot of technical terms. Can you break that down a bit?
Of course. All of those regions, they're interconnected. And they play a role in motor control, sensory processing, and balance.
So, like, what does the thalamus do, for example?
The thalamus, that acts as a relay center for sensory information. And the red nuclei, they're involved in coordinating movement.
I see.
And the vestibular nuclei, well, those are crucial for maintaining equilibrium.
So if these areas are damaged,
yeah,
it makes sense you'd see tremors.
Right, along with other neurological issues.
Because the lesions are disrupting.
The normal flow of information and coordination in the brain.
And that leads to
those involuntary muscle contractions that we see as tremors.
Now, the study didn't just stop at describing these findings.
No, they went further, delving into some potential explanations for these tremors.
Like what?
Well, they drew comparisons to human neurological conditions.
Oh, interesting.
Like Asterixis, Holmes tremor, and Parkinsonian-like syndrome.
Trying to find parallels.
Exactly, trying to gain insights into what might be happening in these cats.
So they're using those human conditions as a framework for understanding the feline tremors.
Precisely. It's like piecing together a puzzle. One of those conditions, Asterixis, it's often described as a flapping tremor.
Oh, interesting.
And it's seen in people with liver disease.
And they think this Asterixis could be related to the tremors in the cats.
Well, it's not a perfect match, but there are similarities.
How so?
Asterixis involves these brief lapses in muscle contraction, often noticeable when someone extends their arms and hands.
Okay.
Now, it's tough to definitively diagnose Asterixis in cats.
There, you can imagine.
But the researchers suggest that some of the tremors they observed in the study, might have similar characteristics.
So it's like they're looking at these human conditions as pieces of a puzzle.
Yeah.
Trying to see if any of them fit into the bigger picture of what's happening in these cats.
Exactly. They also talked about Holmes tremor.
And what's that?
It's a rare neurological disorder, characterized by low-frequency tremors that happen both at rest and during intentional movement.
Interesting.
And it usually comes from damage to specific brain pathways.
Which ones?
The ones involved in motor control, including the cerebellum, the thalamus, and the red nucleus.
Wait, those are the same areas they saw affected in that cat MRI, right?
Precisely.
Yeah.
So that connection is definitely significant.
It's got to be a clue.
It could be. But Holmes tremor usually requires a double lesion, affecting both the dopaminergic nigrostriatal system and the cerebellothalamo-cortical pathway.
So two areas need to be damaged.
Right. And whether that's the case in these cats with HE-CPSS is still unclear.
Okay, and what about that Parkinsonian-like syndrome they mentioned?
Right, so Parkinsonian-like syndrome, it shares features with Parkinson's disease in humans.
Makes sense.
It's often associated with manganese accumulation in the basal ganglia.
Yeah.
Which are those brain structures involved in movement control. Remember we talked about hypermanganesemia?
Yeah, the high manganese levels.
Right, so that manganese toxicity could be playing a role in those tremors.
But it sounds like we need more research to know for sure.
Absolutely. The study acknowledges that there's still a lot we don't understand.
I don't know.
It's likely a combination of factors contributing to these tremors, and figuring out how they all interact, it's really complex.
So this study is more like a starting point then?
I'd say so. It's raising important questions and paving the way for future research.
To really dig deep into these neurological mysteries.
Exactly. Now, even though we don't know the exact cause yet, the study does offer some insights into treatment strategies.
Oh, okay. Like what?
Well, as we mentioned earlier, most of the cats received a combination of medical management and surgery.
Can you break those down a bit further?
Sure. The medical management mainly involved lactulose.
That's to reduce ammonia levels, right?
That's right. They also put the cats on a special diet formulated for liver disease.
And what about the surgical approach?
The goal there was to address the underlying portosystemic shunt, the abnormal connection between the portal vein and the systemic circulation.
Right, allowing those toxins to bypass the liver.
Exactly. So by surgically correcting the shunt,
they're restoring the liver's ability to filter those toxins.
You got it. And the results were actually quite encouraging.
How so?
Many of the cats, especially those who had the shunt surgery, saw their tremors improve or even go away completely.
So even though HE-CPSS is serious,
yes,
there are effective treatment options out there.
There are, and it just goes to show how important early diagnosis and intervention really are.
The sooner the better.
Exactly.
So for listeners whose cats have already had the shunt surgery, anything they should be on the lookout for?
Even though surgery is often successful, it's important to be aware of potential complications like PANS, postattenuation neurological syndrome. It can occur in some cats after shunt surgery.
What does that look like?
Well, it can cause a range of neurological signs.
Such as?
Tremors, seizures, changes in mental state.
So even though surgery can be a game changer,
it is for many.
it's not a guaranteed fix.
Right. Ongoing monitoring is crucial.
Absolutely. This deep dive has been really informative,
It has.
shedding light on a complex and often overlooked aspect of feline neurology.
It really has. And while we've learned a lot from this study, it also highlights how much more we still need to learn about tremors in cats with liver disease. It really does highlight that. So to wrap up, what are the main things you think our listeners should take away from this deep dive?
I think the biggest takeaway is tremors in cats.
Yeah.
They should never be ignored, right?
Absolutely not. They shouldn't be dismissed as just
old age or...
old age, anxiety, nervousness.
Right, because it could be a warning sign for something more serious like we talked about.
Like HE-CPSS.
Exactly.
So if you notice your cat experiencing tremors,
Especially if it's a new thing.
especially if it's new or if it seems to be getting worse,
Don't wait.
don't hesitate.
Talk to your vet.
Contact your veterinarian,
Early diagnosis and treatment are key.
Couldn't agree more.
Now, we focused on a specific type of liver shunt,
Right.
but tremors can occur with other types of liver disease too.
They certainly can. Any condition that impairs liver function could potentially lead to tremors.
So even if your cat has a different liver problem, keep an eye out.
Keep a close eye on them.
And for those cats who have already had the shunt surgery, what should owners be thinking about?
Well, even though surgery often helps resolve the tremors.
Not a cure-all.
Not a guaranteed fix, no. It's crucial to remember those potential complications.
Like PANS.
Like PANS, exactly. So if you see any new neurological symptoms after surgery,
don't wait.
Get in touch with your vet right away.
This deep dive has really emphasized how important it is to understand the nuances of feline neurology.
It really has. And I think this study, it gives us some great insights, but it also shows just how much more research we need to fully understand these conditions.
The more we understand, the better we can help these cats.
Exactly. One question this research really raises for me is the role of manganese in HE-CPSS.
Oh, that's interesting.
Could further research into this neurotoxin lead to new treatments or even prevention strategies?
That's a great point.
It's definitely an area that warrants further exploration.
Well, on that note of scientific curiosity, we'll wrap up this deep dive into tremors in cats with hepatic encephalopathy.
From Vet NeuroJar, keep those minds-inspired hearts light and tails wagging.